Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, November 17th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, the focus of this week's update is going to be on healthcare, both at the local level, the state level, and as well as a little bit of a taste of what's happening at the federal level nationally across the country. But before I get into those details, let me first remind you that today, on Friday, November 17th, for those of you watching it after today, we will be holding our South Coast, Massachusetts area meeting. Once again, it will be at White's of Westport. It kicks off at 11 a.m. this morning. I'm very much looking forward to being back down in Westport. This is the traditional location of Mass Retirees South Coast area meetings. I have now been with the association for 29 years, and we've been meeting at White's every single year, so it's very nostalgic to get back down to White's. This is also tends to be one of our highest turnout members, so we're probably going to have somewhere between 200 to 300 members at this meeting this morning. So super excited. Again, it starts at 11 a.m. Our meetings tend to last about an hour and a half or so, maybe a little bit longer with Q&A and the door prizes, but you'll be back on the road really no later than 1 o'clock. We'll be there before the meeting and again after the meeting to talk to you, to answer any questions you might have, or to help resolve any problems that you might be having relative to your health insurance or your pension or Social Security or really anything related to your retirement. Now, of course, our area meetings are open to all Mass Retirees members and associate members, and you're also welcome to bring a guest. And we'll be drawing the cash door prize at the close of the meeting like we always do. So if you stick around to the end of the meeting, you have a chance to win a little bit of cash to take home with you. So if you are down in Bristol County on the Westport area later this morning, come on by, say hello. In a couple of weeks, on Tuesday, December 5th, we will be holding our final meeting of 2023. That will once again be in Auburn at the Auburn Elks. Start time is 11 a.m. Remember, it's a Tuesday meeting on December 5th. It's a different day of the week. We had to pick in order for the Elks to be able to accommodate us. Now, the second thing I want to remind everyone of, if you didn't see my email to you earlier this week, I believe it went out on Tuesday, there was an announcement late Monday evening, Monday night, that the U.S. House Ways and Means Committee and the Subcommittee on Social Security, the Republican majority, has scheduled a public hearing on the Social Security windfall elimination provision and the government pension offset. That hearing will take place this coming Monday, which is November 20th. The hearing takes place in Baton Rouge, Louisiana. Now, why Louisiana? Well, the lead sponsor of H.R. 82, which is, of course, the full repeal legislation for weapon GPO, the lead sponsor is Congressman Garrett Graves. He represents Baton Rouge, Louisiana, and in addition to that, the new Speaker of the House, Mike Johnson, also represents the state of Louisiana. So we believe, and we're kind of reading the tea leaves here, that those factors are really what has centered this listening session that's taking place on Monday. The hearing is designed to take the testimony of public retirees who have been harmed by the weapon, the GPO. The hearing is not specifically on any of the legislation, such as H.R. 82 or the other bills that are pending, to do something about the problem. It's to take in information and receive testimony, again, from retirees who have been harmed by these issues. Now, in order to testify before Congress, you have to be invited. This hearing, from what we understand, is really just focused on the constituency within Louisiana who will be providing verbal testimony. However, our association has been invited and asked to submit written testimony, which we will do. The deadline to submit written testimony is on December 4th. We have posted on our website, massretirees.com, as well as on our social media pages, the information in the suggestion that our members who are harmed by weapon GPO, and there are tens of thousands of you, we know that, we're asking that you submit a short statement about your personal situation. What led you to become eligible for Social Security? I know many of you worked second and third jobs. Sometimes you worked you served in the military, you worked in the private sector, you cobbled together enough quarters over a lifetime of work to qualify for Social Security, and you're being wrongly reduced in those benefits because of the WEP. And with the GPO, in many cases, the spousal Social Security benefits completely wiped out. So what we're asking is just a short statement, explain your circumstances, explain how you became eligible if you are eligible, and then talk about the financial harm that one or both of these laws is bringing upon you as a retiree, but also your family as well. Because these are really issues that not only impact individuals, but entire families. And this is what we really want to hit home with Congress. Now, we're hoping that the continued pressure being brought about by our association and all of the different groups around the country who are working together on these issues really is forcing the hand of Congress to finally act, to do something to bring relief to retirees. So with that, let me shift gears over to talk about health care. Because as important as your pension and COLAs and Social Security and all those things certainly are, your health insurance benefits and your access to high quality and affordable care is just as important. And a large part of the day-to-day work we do here at Mass Retirees and our overall mission is focused on retiree health care. Now, over the last 3 weeks, we have been heavily involved in all sorts of issues related to health care. And we're also seeing at the same time a definite uptick of activity around the state. Now, our legislative liaison, Nancy McGovern, is also our point person when it comes to local health insurance. She has been working very closely with the Mass Teachers Association, the American Federation of Teachers, the AFT, with the PFFM, with the various police unions and other public employee unions at the local level to make sure that retirees are properly represented at the bargaining table and to give retirees the information that you need in order to defend your rights to your benefits. And together we can get out in front of some of these issues. But we know there is increased activity across a number of cities and towns, particularly at the town level across Massachusetts. No one has really made any changes at this point in time beyond kicking the tires, if you will, of either looking at switching plans or looking at perhaps joining the GIC or withdrawing from the GIC. There's a lot of talk, but not a lot of action. So this means that it is really important for us to continue to be proactive, to get out in front of these issues, to educate our local retirees, that we can work together to better serve our local members. Now, you've heard us report on the Blue Cross Blue Shield Forum that took place back in October, where our association and the unions brought in all of our PEC members from across Massachusetts, and it was really an educational forum of the ins and outs of healthcare bargaining. And it was very successful. We are very appreciative of our friends at Blue Cross for helping us to put together the forum and hosting it and facilitating it. They are true partners in this process, and I believe we're going to see more forums of that sort coming up into 2024. This past Wednesday, Nancy, Frank Valeri, and myself participated in Blue Cross Blue Shield's Labor Advisory Committee meeting. We meet 2 or 3 times a year. Mass Retirees has been a participant on the Labor Advisory Committee, I believe, for probably close to 30 years, if not longer. It's something I have been involved in the whole time I've worked for the association. The purpose of the Labor Advisory Committee is really twofold, or even more than that. First of all, it allows Blue Cross to use labor and retirees and other affiliated labor organizations as a sounding board for them to report on the innovative ideas and approaches that they're utilizing as an insurance company and as the largest insurer in Massachusetts to better serve our collective membership. It also provides us the opportunity to ask questions and to get some knowledge before it's widely known of healthcare trends, what's happening in the marketplace, what are the things that we need to know about on your behalf. And also, as I said a moment ago, for Blue Cross to come to us collectively and say, hey, these are the things we're thinking about. These are some of the approaches we're thinking about taking. What do you think? What would your members think of this? How would they react? Do you think this is a good idea or a bad idea? So it's been a very fluid process over the last several decades. Again, we're very appreciative for the Blues for facilitating these types of venues, bringing us all together, and everyone certainly benefits from it. So on Wednesday at their Quincy offices for 3 hours Wednesday morning, they had a number of executives from Blue Cross make a variety of different presentations, everything from prescription drugs to mental health, to cybersecurity when it comes to healthcare, to some of the future-looking aspects of artificial intelligence and how that might be utilized in the healthcare space. So it was truly fascinating, and it really gave us some insight into what's coming next. Now, just yesterday, the States Group Insurance Commission held its very first in-person commission meeting since prior to the pandemic. I believe the last meeting of the GIC took place in either late January or early February of 2020. And for the past 3.5 years, their commission, which is made up of 17 members, has been meeting exclusively remotely. Well, they, again, yesterday had their first in-person meeting, and while we regularly interact with Matt Vino and his staff at the GIC, it was great to be able to see everybody in person, see the commissioners in person. It was also very good for us to be there to hear the presentation of David Saltz and the Healthcare Policy Commission. Now, if you've read your November newsletter, you know that we wrote a pretty large story about HPC and their 2023 report on healthcare cost trends in Massachusetts and some of the concerns they have of the trends that are taking place just in terms of medical inflation. Well, they made that presentation to the GIC today. There was a lot of great interaction, some fantastic questions from the commission, and the GIC works hand in hand with HPC to put into practice some of the recommendations and the findings of HPC. And it is a very fluid process. It really is benefiting our members and the active employees who are insured through the GIC. And I believe at this point in time, there's roughly 465,000 lives insured under the GIC. So it is a huge plan. But it was really interesting to be in the room today to hear that presentation. And as we said in the newsletter article, we're very fortunate here in Massachusetts that we have agencies like HPC and healthcare experts involved in the process to better serve our membership, and all of us are better off as a result of that. Now, the last thing I want to touch on, and I ask those of you who are Mass Retirees members who receive the weekly email message from me, take a close look at this week's email message. The reason for that I'm highlighting that is that my next topic is the conference that Nancy and I attended in Washington, D.C. About 3 weeks ago. It was the annual conference of the Public Sector Healthcare Roundtable, which is made up of several dozen public employee, public retiree health plans from across the country. So it's plans like the GIC, but from all of the other states. As a matter of fact, Matt Vino from the GIC participated in the conference along with Nancy and myself. It was truly fascinating. We received a lot of information, so much information every day that we were truly exhausted after the session ended. It was just really jam-packed. But we touched on everything from healthcare policy at the federal level, some of the trends coming down the road, healthcare cost containment, of course, pharmaceutical benefits, and the growing efforts across the country to gain control over those costs, including the steps being taken by Medicare, who can now negotiate over certain prescription drug prices. So it was truly a fascinating 2.5 days in Washington, taking in all this information. I get into more of the details of this in today's email message, so take a look at it. We're also going to have a more in-depth report on the Roundtable conference in the January newsletter. There's a lot of information, and I don't think you want to watch this video or listen to this video and have me try to digest everything that we learned. This is just too much to really verbalize in a forum like this. But it was very helpful to us, not only to learn about what's happening around the country, but to also know that some of the things that we're working on here in Massachusetts and the direction things are going in, that we're not alone. These are problems that everyone across the country is facing. There are a lot of innovative ideas. We learned, for instance, out in Colorado, there's a lot of innovation taking place in the wellness and disease management space. And of course, that's something that's of immediate interest to us, in particular because we continue to work very closely with Sensio Systems in promoting the IBIS telehealth platform, which is geared towards retiree wellness and disease management. And it's really proving, even though we're in the early stages of this, is proving to be highly effective. So much so that both Unicare and Maya have partnered with Sensio in promoting IBIS to their enrollees. So all of these things are interrelated. And again, the benefit for us being present at these various forums and being able to participate and ask questions and take in all this information is that we can better serve our membership, which is what this is all about. So with that, I'm going to log off for today. I think I've given you a lot of information. We'll be back next week with a Thanksgiving message for all of you. We're going to keep it a little bit light, but we're also going to post on our website and on our Facebook page on Monday the link to those of you, or for those of you who want to tune in and watch live the congressional hearing taking place on Weapon GPO on Monday. But I hope you're all well. Enjoy the weekend, and we'll be back to you real soon. Bye-bye, everybody.